Welcome all, I'm joined today by Dr. Thomas Lee, the Director of the Vision Center at the Children's Hospital of Los Angeles. We'll be discussing the cooperation between the Children's Hospital of Los Angeles and the Armenian EyeCare Project. So Dr. Lee, thank you very much for your time.
Oh, glad to be here. Thank you for inviting me.
So before we get into the cooperation between the Armenian EyeCare Project, which is a non-profit which has been providing eye care, patient care, research, education to the Armenian population and the Children's Hospital of Los Angeles, can you tell me a bit about the Children's Hospital of Los Angeles and when Roger Ohanessian, the founder of the Armenian EyeCare Project, got in touch with the hospital?
Sure. Children's Hospital Los Angeles is a very large, what we refer to as a tertiary care center, where we take care of very complicated patients. It's based in Los Angeles, next to Hollywood, actually in what is called Little Armenia, and not too far from Glendale. So the hospital itself is very integrated into the Armenian community already in Los Angeles. It's a very large hospital. We have about 400 beds for children, and we see in total over 350,000 exams, outpatient exams per year, and have experts, world experts in almost every discipline of pediatric health. The Vision Center is a very large division within that hospital, so we have about 21 doctors who are all focused on different aspects of childhood blindness. And a specific area of interest of ours is in premature infants who can go blind from a condition called retinopathy of prematurity. It turns out that back in 2000 to 2010, the premature infant population in Armenia was rapidly growing. They were creating neonatal intensive care units. These babies who would normally not live were now surviving, but they actually did not have any experience with this other part of prematurity called retinopathy of prematurity. That's a condition that I mentioned that can cause childhood blindness in as quick as 72 hours. So by 2009, there was an epidemic of babies who were blind coming up into their pediatrician's office, and they realized that they were dealing with this condition that they had no experience with before, retinopathy of prematurity. And so it was estimated in 2009, about 100 babies had already gone blind from a very preventable disease. At that point, Roger Ohanessian, president of the Armenian EyeCare Project, approached me to help train the doctors here so that they could be part of the solution in preventing these children from going blind. I remember very vividly, Roger had approached me with a colleague of his, and I actually had no idea where Armenia was. He told me the problem, and I initially told him I would give him my lectures and I could teach him how to do the talks, and then it migrated to me doing it over the internet with WebEx or Zoom, and eventually Roger had convinced me I really needed to come here in person. And so in 2010, we actually scheduled a workshop, and over 3 days taught both the pediatricians and the eye doctors about retinopathy of prematurity for the very first time. And in that process, actually saw children in the neonatal intensive care units where we could actually show them what the disease looked like. And it turns out there were 4 babies at that time who were actively going blind and were in that 72-hour window where we could intervene. And so on that first trip, we actually taught them how to do the laser surgery. That is the therapy, the treatment. And when done properly, has a 90% success rate. And it's done at the bedside, it's non-invasive. So we actually had the opportunity to do that as well. And so for the very first time in the country's history, in 2010, Armenian eye doctors took care of Armenian children to prevent them from going blind. As part of that program, we had the Armenian EyeCare Project purchase digital cameras that would image the retina in these children and then upload it to the internet, where over the next year, we continued to monitor and supervise their training as if we were right here in Yerevan. And by the end of the year, the success rates for treating ROP were equivalent here in Yerevan to what the experts were doing in the United States. And that was all by using technology.
And there were descriptions of a growing wave of blindness, which you mentioned, or preventable blindness. Is it understood what were the factors that caused this? Or?
Well, prematurity by itself puts a child at risk, even in the United States. And so in the United States, it's mandated that every NICU have the ability to screen for ROP, so they have to have an eye doctor there. In addition to just the risk of prematurity, also how you use oxygen to supplement a child in the incubator is also very important. And that was another point of training that we could do.
And now in Armenia, I have heard that the Children's Hospital's assistance has changed in a way because, as you mentioned, now many Armenian doctors are familiar with this sphere and are able to provide care in the appropriate way. Can you describe how the cooperation with the Children's Hospital has changed?
So starting with the premature infant, we recognized the need for supplemental training for the neonatal nurses. And so we started an online lecture series that we had created at Children's Hospital, had it translated into Armenian, and showed that they actually improved their competency with that. That then led us to help them develop what's called a neonatal simulation center, where we have, in the US, we train our doctors on basically robots. These are mannequins that have sensors and react like an infant, and they're hooked up to a computer, and you can program the mannequin to go through different diseases and conditions. And so we set up the very first simulation center that has now trained over 350 neonatal healthcare practitioners, both doctors and nurses. When we recognized the benefit that we were having in neonatology, we also discovered that there were other areas of pediatric care where we could support them. And so we started looking at creating online content and online courses for the Armenian doctors here in the area of pediatrics, such as neonatology, allergy, immunology, and also just general pediatric care. And so we've created a production team at Children's Hospital that does videos, podcasts, and newsletters to all supplement the training and the resources that the Armenian doctors have here. One other element was that we were asked to help them supervise surgery over the internet, and ended up developing a surgical center in a neonatal intensive care unit, so a labor and delivery hospital, that was outfitted with a high-speed internet that would broadcast out to the doctors and the experts in other parts of the world to help supervise. So we did that, and it was actually selected as the keynote presentation at Microsoft's annual worldwide Congress. And so that was a real, what we call game changer, because it allowed us to continue to supervise without being here, but we did it in real time by having the surgical microscope broadcast to the internet exactly what the Armenian doctors were seeing. And then we would actually have multiple doctors on the other end, so it was a multicast. And that's not even something we can do in the US. And so it's only in Armenia, in Yerevan, that has that capability. It's the only surgical suite that's connected to a labor and delivery hospital.
I mean, you kind of spoke about this, but the Children's Hospital of Los Angeles seemingly is taking an innovative approach to all projects, to all sections of a project. Can you speak about the importance of taking this approach and how this pertains to its work cooperation in Armenia?
Because Armenia is exactly 12 time zones away, we have to be very innovative about how we support, because we can't be here all the time. And I think the consistent part of the story has always been, how do we leverage technology, and specifically the internet, to scale the knowledge that we have at our hospital and make it available and accessible for the doctors here in Armenia. And whether it was the original project that used a simple fundus camera or retinal camera, still images that would upload, to using a high fidelity video conferencing system and connecting it directly into the surgical microscope. These have all been elements where technology has been the only way forward for us to rapidly make expertise available to the doctors here. And the Armenian EyeCare Project has been so helpful in helping us establish all those relationships and partnerships, because as you can imagine, it takes a fair amount of effort to get some of this stuff done.
And Dr. Lee, obviously, one of your first visits to Armenia was in the early 2010s. I'm wondering, what has the journey been like? How do you feel about the progress that has happened so far?
Of all the things I will have done in my career, this is by far the most meaningful and gratifying efforts I've made. When I go back to that very first encounter back in 2010, I had mentioned that we had treated 4 children. And so 2 weeks later, I called the surgeons who we trained to do that and how those kids had done. And they said 3 of the children had done really well. And the parents knew that it was the very first time it had been done in the country's history, so they were incredibly grateful. The 4th child had exited that 72-hour window, and despite our best efforts, that child went blind. And when I asked, like, how did the parents take it, he said the parents never came back. And so that child's an orphan. And the child's an orphan because we had scheduled our workshop 1 week too late for that child. And it just emphasized to me how important our work was and the impact it can have on a family if your child has the ability to see a sunset versus not. And so when I look back at the past 12 years that I've been working with the Armenian EyeCare Project in the country of Armenia, the most gratifying thing is knowing how much the Armenian doctors care about the children they serve. And because of that, they're the most impressive students I have ever trained. I've been in this business now for 25 years. By far, the most motivated learners are the doctors here in Armenia. And it's because of their passion for their children that all of our programs has been as successful as possible.
Well, Dr. Lee, we appreciate all the work you do. Thank you very much for your time.
Thank you so much.
And thank you for joining us on CivilNet.